Hello everybody, I hope you're doing well. My name is Joel.
My name is Jade.
And welcome to Georgian Care. Hello and thank you guys for sticking around. Welcome to this week's edition. We will be talking about typical and atypical development with children aged between 6 and 12, and at the end we will also end it with talking about COVID-19 and the effect it has on children. So guys, just stick around and we shall go into it soon.
So with a typical child's development, you will find that their speech and language is improving. They will be speaking clearer. They'll be forming rather longer sentences. They even might start copying their parents or siblings. Their handwriting will start to improve. Their numeracy skills, so adding, dividing, multiplying, subtracting, they'll be getting better. They will actually start to show embarrassment as well. They may even start arguing with their parents. Their biggest academic milestones, they'll begin to start forming.
Yeah guys, so don't forget, we're talking about here, we focus on typical. We don't like to do with normal, abnormal, as Jade mentioned in the previous videos. Today we're just talking about, we like to focus on typical and atypical. So these are the signs, what Jade just mentioned, we're talking about typical. So these are some of the signs that you might be able to see between the age of 6 to 12. Now in this stage, we'll be talking about some of the skills and activities some of the children might be interested in, between the age of 6 to 7. So some of the skills you might see some of the children being interested in, so it could be, interested in numbers, interested in things like art, craft, painting, knows what's left, what's right, knows days and night. They like to share and they like also to make friends, because friends become very important to them at that stage. However, they can become a bit jealous of their friends and people, even their siblings, and at times they can start developing temper tantrums.
The children between 8 to 9, they can understand the date, so they'll be able to know what date it is that day. They can list the months of the year and the days of the week in order. They begin to play more games, so they become more competitive, so they play chasing games, they can skip, they can jump. Dressing themselves completely. They can count backwards, understand fractions, and they start to be more sociable, especially with children they don't know. So they join clubs such as brownies or cubs. They enjoy things like that.
So some of the typical behavior that we might see from children from age 10 to 12 now might be things, some of the activities may be like sewing, painting, writing stories, reading books. They're very good at writing. They can get good at writing as well. Enjoy being on the telephone, having friends. So at this stage, best friends become important, and have an increased interest on the opposite sex. Sorry parents, this is when you start losing your daddy's girl or mommy's boy, because at this stage they start having interest on the opposite sex, which is quite common.
It doesn't mean it has to be that.
It doesn't mean so. Exactly. It could be just friends.
Just acknowledge the other sex.
Yes. Yeah, so obviously they also, respect others. They enjoy others' company, like talking to others, and yeah.
They have a lot of respect for parents as well at this age.
Yeah.
Now we're going to talk about the atypical child's development. Now it's very important that you pay close attention to your child while they're developing, so that you can notice whether they're hitting the milestones early or late. Particularly children between 6 and 12, they're at school already, so they're struggling with maths or English or any of the activities or skills that you would expect your child to know how to do fluently, if that's the right word. If you're noticing that they're struggling, then you can talk to their tutor, see if they're noticing the same things. Maybe they're struggling with friendships or any social interaction or other academic areas. Another reason it's important to monitor your child while they're developing is that if they are struggling in a particular area, then perhaps you'll notice it. But even if not, the child might be suffering in silence, and if you've been monitoring them closely, then you may be able to see it through non-verbal communication. Their behaviour may change, or they're, as I said before, struggling in a particular area that you feel that they shouldn't be. That could be a sign that they've got a condition that has not been brought to your attention yet.
So I'm going to rattle off a short list of some of the potential diagnoses that children between this age of 6 to 12 might be diagnosed with. So one of the main one being attention deficit hyperactivity disorder, which is also known as ADHD, and another one also attention deficit disorder, which is ADD. Some of the diagnoses are also autism, depression, anxiety, trauma, eating disorder, schizophrenia. I know some of this term might be a bit unfamiliar to some of you guys, but I'm sure down the line when we're going deeper into mental health, so we'll probably speak on some of these terms like schizophrenia, mood swings, depression, because it's good for us to just be naming this diagnosis out here, but some people may not know it. Some people may be confused. What is schizophrenia? So down the line, I promise you guys, we will do a deeper video detailing what these diagnoses are. So I'll go back to the list again. Post-traumatic stress disorder, which is also known as PTSD, Tourette syndrome, obsessive compulsory disorder, also known as OCD, oppositional deficient disorder, known as ODD, and lastly, conduct disorder. There's a whole list of them. I've just picked the main ones, but I'm sure you guys can go online and check, and you'll see a whole larger list. But this is just some of the main ones that we've managed to put together for this video.
So there are some warning signs that your child might be going through changes in their mental state, or in other words, developing a mental health condition. They could have difficulty sleeping, or loss of appetite, or equally overeating. They may have a lack of interest in social activities like going to brownies and clubs, like I mentioned earlier. Maybe they don't want to see their friends anymore. They start skipping school.
Yeah, so even in school, you might, teachers might give reports, your children becoming more irritability, outburst, getting involved in fights and all those kind of things. So those are some of the things, that which are quite important to look out for.
On a more extreme note, actually, the child may begin to start talking about death a lot, or may even talk about possibly attempting suicide, or may have even attempted suicide. Things to look out for would be maybe scratches on the inside of thighs or on the arms. Superficial, so nothing too severe or dangerous, especially if it's a first attempt. It would just be kind of a test. There's definitely things to look out for, but obviously we're not saying check your child all the time. We're just saying if you've noticed a change in their behaviour, so like violent outbursts, or the tantrums are getting a bit excessive, or they're sad maybe for 2 or 3 weeks consistently, then you start, maybe ask them first, and then start looking to see if you can see things, talk to the teachers, maybe get some advice from the doctor, things like that, before jumping to conclusion, because it could just be nothing. It could just be your child just in that mood for no reason.
Yep, and remember, we're not here to diagnose, we're not diagnosing, we're not saying if you see your child with any of the symptoms, you quickly run, oh, Joel and Jade said this, therefore is this. That's not what we're saying.
We're not teaching you how to look after your children.
Exactly. I believe you guys are the best master out there. You guys know your children. Nobody knows your child more than you. So if anything, you know your child's behavior more than anybody. But what we're trying to do at the moment is just give a general understanding to everybody. I think these are things that you may want to look out for. So you may reach a point where you've noticed that your child is experiencing all these symptoms that we're talking about, and you may be quite concerned. So the next stage would be, what do? What's the next process after that? My advice would be to speak to your doctor or your local GP. They may want to, explain to them what your child is going through, some of the experience in detail, and also they would probably like to speak to the child as well, just to get a broad knowledge and understanding what the experience of the child. Also to understand, the severity of the experiences that the child is going through. The next stage from that will also be, they'll probably make a referral, because it's a child, they might refer them to CAMS, and I'll let Jade explain what CAMS is.
The Child and Adolescent Mental Health Unit.
Exactly.
So basically there's a unit normally within a hospital, so maybe A&E, I think generally they'll be in there, the mental health department, and they'll have a nurse there, they'll have a psychologist, also a psychologist or psychiatrist. I think more likely to be a psychiatrist actually, and then the child will be referred there, and they'll go and have a visit, and then the nurse will ask questions similarly to the doctor. They'll just try and find out when the symptoms began, the severity, as you said, what it's like for the child to experience these things, how they've been feeling, has it changed their life, just try and understand from the child's perspective. And then, two things can come from this. It will, depending on the severity, if your child is attempting suicide, then likely they will keep the child in the hospital overnight for more assessments, only if they feel that the child is in danger of themselves or to other people. Other than that, the child will probably go home, they'll do the assessments and call you back in.
Yeah. And also, just on the same line of the assessment, they also may want to see how persistent is those symptoms. Is it intermittently? Is it quite consistent every day? So my advice is, as a parent, obviously I'm not trying to tell you guys what to do as a parent, but what I like to tell people is, have a diary, make a diary. If you're noticing this thing, note it down. Is it every day? Is there a particular time that the symptoms comes? Just try also your best as a parent to get involved and start writing a diary, because at that age, between 6 to 12, the child might not exactly understand what's happening, and they may not be have the awareness to writing things down. So this is how parents can help our children whilst they're going through those kind of stages. As Jade mentioned, once they get into in CAMS, some of the treatment maybe they might stay overnight. It might be medication involved. Obviously, consent will have to be received from the parent. So the psychiatrist will go through some medication options, which is the last resort, because I always like to deal with talking therapists, like psychotherapy, counseling, CBT, which is cognitive behavioral therapy. I'm trying not to use these abbreviations because they might be confusing for some. So yeah, those are some of the treatments out there, that's available to help anybody between the age of 6 to 12 experiencing these symptoms.
There's medication as well, but you don't really like going for medication straight away. And actually, I think a lot of nurses and psychologists, psychiatrists prefer to go the homeopathic route first and use medication as a last resort, because sometimes they can be quite addictive, or there are some side effects that could be I wouldn't say life-changing, but uncomfortable. It can make your life uncomfortable, not forever, just until your body gets used to the medication.
So I think we spoke quite extensively on this topic between 6 and 12. There is more that we can go into detail, but I think we've pretty much said the important part. Next week we will talk about from 13 to 18. Yes, she's very good at remembering these small details. So whenever I direct to her, then just know that she will give the answer.
Hopefully.
Yeah, hopefully, because sometimes she does forget. 13 to 18 teenagers, they're a very important age, you know, the teens. I'm excited about that. Are you? Yes, I'm excited about the teens. Yeah, so we'll talk about that next week. I hope you guys have a lovely day or evening or night, depending on the time you're watching this, and
Stay safe.
keep staying safe, you know.
Wash your hands, you know, all this.
Yeah, and maintain your social distancing, and we shall see you all soon next week. Bye bye.